You're over 60 and have noticed that your choices are no longer as firm or consistent as they once were. You wake up and those morning elections that were once normal are gone. Do you feel like your sex drive along with your energy is slowly decreasing? Listen very carefully because what you're about to discover can completely transform your intimate life and overall health. Everything, absolutely everything, begins with something as simple and as everyday as what you do just before going to sleep. This is the warning you can't ignore. If you don't pay attention to this before going to bed, your body will begin to disconnect from its true sexual potential. And it's not age that's the fault, but rather an accumulation of everyday mistakes that often go unnoticed. As a doctor, I can tell you clearly, the quality of your nighttime and morning erections is one of the most accurate indicators of your cardiovascular and neurological health. When these choices disappear, it's because something inside you is failing. But before talking about the solution, let me explain something fundamental to you. What happens to your body while you sleep? During deep sleep, especially during REM sleep, your body activates vital regenerative processes, one of the most important of which is the production and maintenance of spontaneous responses. Even if you're not having sex, your penis is aroused while you sleep. This happens 3 to 5 times a night completely naturally. Why does this happen? Because it's how your body maintains healthy erectile tissue, stimulates circulation and oxygenation of the penis, and preserves sensitivity and sexual performance. And what happens when these nocturnal erections disappear? The tissue begins to atrophy. Blood flow decreases. The elasticity of the corpus cavernosum decreases, and the risk of permanent erectile dysfunction increases, all of which can happen without you even realizing it. Silently. Night after night, until one day your body simply no longer responds. So, what can you do before bed to prevent this? Here is the key that no one reveals to you. Eat dinner at least 3 hours before bedtime. Eating a heavy meal just before bed blocks circulation because your body focuses on digestion, not regeneration. This decreases the production of nitric oxide, the molecule that enables an erection. And if you also consume alcohol or sweets at night, the effect becomes even more negative. Avoid screens at least 60 minutes before bedtime. The blue light from your cell phone or TV suppresses melatonin, the deep sleep hormone. And without deep sleep, there are no nocturnal erections. Furthermore, lack of rest generates stress, and stress destroys desire. Do this breathing before going to bed. Only 2 minutes. Inhale for 4 seconds through your nose. Hold your breath for 4 seconds. Exhale slowly through your mouth for 6 seconds. This activates your parasympathetic system, which relaxes, repairs, and improves circulation. Do this 5 times, and you'll notice how your body enters the ideal state for sleep and regeneration. Drink a glass of warm water or a natural infusion. Your penis needs to be well hydrated to stay firm and function fully. Nighttime dehydration thickens your blood, slows flow, and can cause micro-injuries to the erectile tissue. A ginger, cinnamon, or Janin tea is ideal before bed, and above all, make sure you get at least 7 hours of sleep. Sleeping less than 6 hours each night reduces testosterone by up to 30%, and without testosterone, there is no desire, no potency, no energy. In short, if you're a man over 60 and want to maintain your potency, don't expect a miracle pill. Start with something much more powerful, your bedtime routine. Because if you don't give your body the rest, circulation, and environment it needs, night after night you'll lose something invaluable. Your inner vitality. Can you relate? Leave 1 if you already have difficulty with your morning erections. A 0 if you want to prevent before it's too late. And if you learned something new today, write "I'm awake" in the comments. Because talking about this is also part of being a conscious man, of taking care of your health. And what comes next? In the next section, we'll discuss 3 morning exercises that will reactivate blood flow to your penis in less than 5 minutes, so you can wake up every day with more power, more confidence, and more control. Subscribe to the channel, ring the bell, and share this message with another man who needs it. Your sexual health is not a luxury, it is part of your power. 3 morning exercises that reactivate blood flow to the penis in less than 5 minutes. In the first part, we talked about what you should do before going to sleep to avoid losing your erections. Now, let's talk about what to do when you wake up. Because yes, what you do in the first few minutes of the day can make the difference between a day filled with energy, active circulation, and desire, or a day of fatigue, apathy, and weak or non-existent erections. Listen to this carefully. The penis has no bones, but it needs movement. And not just sexual movement, but bodily and vascular movement. Because erections depend on blood flow, and if your blood is stagnant or circulating with difficulty, there is no potency. So, if you're over 60 and want to keep your manhood active, these 3 exercises I'm going to teach you now should be part of your morning routine. It only takes 5 minutes, and results will appear in days. Exercise 1. Pelvic activation. Wake up the control center. It's a series of gentle movements that stimulate the pelvic floor, the muscular base that supports your bladder, prostate, and penis. How to do it? Stand firmly with your legs slightly apart. Tighten the muscles you would use to stop the flow of urine. Hold for 3 seconds. Let go. Repeat 10 times. This exercise activates the pubococcyx muscle, known as the PC muscle, which is essential for maintaining the strength of your erections and also for controlling ejaculation. Do it every morning when you wake up, even before getting out of bed, if you prefer. Exercise 2. Nitric oxide breathing, bringing oxygen directly to the penis. Nitric oxide is an essential molecule for achieving an erection. Without its presence, the blood vessels in the penis do not dilate and blood does not flow strongly. How to stimulate it naturally through deep, slow, and controlled breathing. The instructions are simple. Just 2 minutes. Inhale deeply through your nose for 4 seconds. Hold the air in for 4 seconds. Exhale slowly through your mouth for 6 seconds. Rest for 2 seconds and repeat. Do this 6 times every morning when you wake up. This exercise increases blood flow, relaxes arteries, and improves your mental state. In addition, it reduces sexual anxiety and boosts your performance during intimate encounters. Exercise 3. Leg curls in place. This is a pelvic pump that quickly accelerates circulation. It's simple but powerful. What should you do? Stand up, relax your arms, and bend your knees as if you were marching in place. Lift each knee as high as you can, alternating between them. Do this for a minute. This movement improves circulation in the pelvic area, activates the lower abdominal muscles, and helps push blood toward the penis naturally. Do it in the morning after going to the bathroom or while making coffee. It's important to emphasize that these exercises do not replace medical treatment, but they are an essential step in regaining control of your sexual circulation. The sooner you incorporate them, the greater the benefits you will feel. Firmer erections, fewer involuntary nighttime escapes, greater control over ejaculation, and more energy upon waking. In short, your sexual potency doesn't disappear suddenly. It gradually weakens as you go about your daily routine. And if your routine doesn't include activation, movement, and oxygen, your body starts to shut down without you even realizing it. These 3 exercises aren't just physical movements. They're a declaration of self-care, a message you're sending to your body. I'm here and I care about you. I won't let you go out. Do you dare to try them? Do it tomorrow. Write active if you are going to do them. I'll do it if you already have your routine, and tell me if you want me to explain it in video or animation. Now, the 3 most common mistakes that destroy your erections without you even realizing it. You may be doing everything right, but still notice that your erections aren't the same. You sleep, eat reasonably, even exercise, but your desire and steadiness continue to wane. Then you will be making one, two, or even all three of the mistakes I am about to reveal. These are such common mistakes that most men don't even consider them a problem. But believe me, these silent habits are slowly destroying your sexual vitality, and if you don't correct them in time, recovery will be increasingly difficult. Mistake number 1. Using alcohol as a nighttime relaxer. Just a drink to sleep better. A glass of wine with dinner doesn't seem harmful. It helps me rest. Yes, alcohol can induce sleep, but what many people don't know is that it completely blocks the deep REM phase, where nocturnal and spontaneous erections occur. In addition, it decreases testosterone, slows blood flow, affects the central nervous system, reduces sensitivity and firmness, and, most alarmingly, normalizes sexual disconnection. It turns you off without you noticing. To do: replace alcohol with natural infusions. Ginger tea with turmeric, warm water with lemon, peace and flora infusion, or melange without hormonal effects. Your body will thank you, and so will your choices. Mistake number 2. Spending hours sitting without moving. This is one of the most silent enemies of male sexual life and also one of the most invisible. After 60, many men spend much of the day sitting in front of the television, computer, in the car, at the table after eating, in bed, before sleeping. This not only impairs circulation but also compresses the pelvic region and reduces blood flow to the penis. That is, your own routines are atrophying your sexual potency. To do: every 30 or 45 minutes, get up and walk around for 3 minutes. Perform gentle squats or stretches. If possible, use an ergonomic chair that does not put pressure on the perineum. Movement is circulation, and without circulation, there is no erection. Mistake number 3. Believing that sex ends with age. This is the most damaging of all because it is not physical. It is mental. Many older men think, "At my age, it's no longer necessary. I don't have a partner, so that's something for young people." And that thought, repeated silently, extinguishes the relief. The body continues to generate desire, sexual energy, and blood flow. But if the mind surrenders, the body obeys. You ignore it? To do? Talk about the topic. Take it seriously. Incorporate small daily actions that keep you in touch with yourself. Conscious self-examination, lower back massages, light physical activity, emotional or affective connection. Don't put out the flame just because there is no fire. Sometimes what is missing is determination. Final reflection of this series. Your erections are not just about sex, they are about cardiovascular health, hormonal balance, and vital energy. Maintaining them is not vanity, it is dignity. After 60, every choice counts. What you do when you wake up, before you go to sleep, what you eat, what you think, all of this builds or destroys your sexual potency. And today, you know how to change. This information resonated with you. Please leave a comment if you are going to remove at least one of these errors. A yes if you had already noticed some but didn't know that it affected your choices. And please comment, "I want more," if you want a new series on foods, supplements, or strategies for older men. Thank you for following this series. If you know an older man who needs to hear this, please send him this video. He may not say it, but he needs to know. Subscribe, hit the bell, and stay tuned because in the next video we'll talk about habits that naturally boost testosterone after 60. And that, believe me, is next level. M.